So we are going to start the side event on the malaria. Your Excellencies, distinguished delegates, colleagues, friends, Dr. Katerina Bohem, the officer in charge of WHO Sierra. Today's malaria side event is honored to be moderated by Professor Emeritus Kamini Mendis, a globally respected malariologist and medical scientist from Sri Lanka. She has made outstanding contributions to malaria research and elimination, including senior leadership roles at the WHO Global Malaria Program. Currently, she chairs the WHO Technical Advisory Group on Malaria Elimination and Certification, providing critical guidance on malaria-free country certification and elimination policies. Her leadership was instrumental in Sri Lanka's malaria elimination success and continues to inspire malaria control efforts worldwide. It is now my great privilege to hand over the session to Professor Mendis, who will guide today's important discussions. Would like to join us in the dais, please. Professor Mendis.
Thank you very much, Dr. Rijal, for that kind introduction. And good afternoon, Excellencies, distinguished delegates, and colleagues. It's a great pleasure to welcome you all to this special side event, Malaria Marathon, the ultimate race to zero malaria in Southeast Asia. This event is also to celebrate Timor-Leste's certification by WHO as a malaria-free country, which takes Timor-Leste a step further to join two other countries in the region, the Maldives and Sri Lanka, to sustain a malaria-free country. Malaria elimination is of immense importance to our region. This is partly because the Southeast Asia region is home to the second highest burden of malaria in the world. But the region has also made an impressive achievement. Southeast Asian region has had the steepest decline worldwide in the incidence of malaria cases and deaths since the launch of WHO's technical strategy, global technical strategy for malaria in 2016. In this region, 3 of the 10 member states have been already certified by WHO as being malaria-free, and 2 others, Bhutan and Nepal, are on the way very closely to eliminating malaria. May I now invite our distinguished panelists to kindly take their seats at the head table. Representatives from Timor-Leste, Honorable Vice Minister, representatives from Sri Lanka, Bhutan, and India, and Dr. Katerina Bohem is seated next to me, who's the officer in charge of the WHO Regional Office for Southeast Asia, and also Dr. Suman Rijal, who is also at the head table. Yes, okay. So to open today's event, may I now invite Dr. Katharina Berman, officer in charge of the WHO Regional Office for Southeast Asia, to deliver her opening remarks. Dr. Katharina, over to you.
Thank you very much, Professor Mendes, and it's an honor to sit next to you. So I must say this is the favorite title of all side events we have this year. You know, I like this very much, Malaria Marathon, the ultimate race to zero malaria in Southeast Asia. Excellent, excellent. So good afternoon to you all. Yesterday, our region witnessed history when Timor-Leste formally received from the Director General of the WHO the certificate for a malaria-free country. It was a proud moment for the country, for our region, and for public health around the world. My admiration and congratulations to the government and the people of Timor-Leste for this excellent achievement. With this milestone, as you said, Professor Mendes, Timor-Leste joins Maldives and Sri Lanka as the third country in Southeast Asia to be certified malaria-free. In these three very different countries with their different contexts, we have three beacons of hope that are together one chapter of success in the story of the region. Even when faced with limited resources, geographical challenges, and competing health priorities, they have shown the world that malaria elimination is possible. The elimination of malaria is more than a goal. It is a promise we made in 2017 through the ministerial declaration to end malaria. Timor-Leste's certification is the manifestation of the determination to turn our promise, this promise, into reality. It reflects the soundness of our strategies and shows us what can be achieved through commitment, collaboration, and perseverance. But of course, as we all know, the race is not over. To sustain a malaria-free status, we need constant vigilance, strong surveillance, and continued political commitment. For all countries still running the marathon, the success we celebrate today is an inspiration, a motivation, and a roadmap to action. We can achieve a malaria-free Southeast Asia together with regional solidarity, cross-border collaboration, and the support of all partners. So let's continue to run this marathon together, step by step, until we cross the finish line. Congratulations again to you, Vice Minister, and to the government of Timor-Leste, and thank you for hosting this event today. Thank you.
Thank you very much, Dr. Berman. We now turn to the newest malaria-free country in our region, Timor-Leste, and I'd like to invite the Honorable Vice Minister, Mr. Jose Magno, who's the Vice Minister for Institutional Health Strengthening in Timor-Leste, to take us through the country's remarkable journey. I believe you will introduce a video which I think will be played. Honorable Minister, over to you.
Thank you, Madam. Excellencies, distinguished delegates, colleagues, and friends, it is a great honor to share with you the story of Timor-Leste's journey to becoming malaria-free. This achievement reflects the determination of our health workers, the commitment of our communities, and the unwavering support of our partners. We are pleased to present a short video, a walkthrough of Timor-Leste malaria elimination journey, a glimpse into the milestone challenges and the collective spirit that brought us here today.
poros malaria ia 2018 lebih hau grave tebe ia hospital awin to fulanida magfuin habo halau haunia actividades.
Like Abel Oki, malaria has stalked families in Timor-Leste for generations. From colonial times through independence, the disease thrived in the tropical climate. Even in the early 2000s, it remained one of the nation's most urgent health threats.
Mahira ita luta ho sistema saúde bem frágil, malaria afeta família rihum barihum. Cada ema mate, husikela tau pa komunidade. Afoi independência, luta hasuru malaria, sai no dar prioridade buat liu, ia ita ni nível nacional.
The journey to a malaria-free future began in 2003 with the Ministry of Health establishing the National Malaria Program. Starting with 2 full-time malaria officers, the actions laid the foundation, kickstarting initiatives like distributing nets, indoor residual spraying, or IRS. The ministry's fight gained strength with support from WHO, the Global Fund, and other partners, building labs, training specialists, and mainly a cadre in entomology.
Tenudar Timoran konten TBS kamahitan kapasitasan idane nebe tamba agora ia una fase free malaria no mos lymphatic filariasis nian.
While entomologists worked through long nights, another front in the fight lay at Timor-Leste's porous borders. With malaria being endemic in neighboring Indonesia, surveillance was and will be a 24/7 task.
Quando é tão contato o CUPF ou comunidade, com líder comunitário, que ataca é mais estrangeiro, também a mim sempre screening.
Ina ba halau homia serviço nessa controla ema usina sambil tamai au tenki hasairan e questionário completo idade ela fating.
One of the defining moments in the malaria fight was the mass distribution of insecticide-treated nets, starting in municipalities like Wekusi and covering nearly 80% of the nation's population.
By 2011, we began to see the first sign of the success. And by 2015, every municipality has reached its elimination level standard. That year, not a single death was recorded. A true turning point in our battle. We felt hope.
In 2020, a small outbreak in Wekusi threatened to reverse years of progress, but swift action contained it. The last indigenous case was reported in September 2020.
After we stopped seeing the new cases, Timor-Leste strengthened the prevention of re-establishment phase to sustain progress. The government set up the National Advisory Commission, the necessary to drive multi-sectoral collaboration. From here on, the fight shifted to the digital tracking every case.
The Ministry of Health doubled down on the policy front, bringing an integrated vector-borne disease control plan and a communication strategy to drive lasting behavior change. By 2023, after decades of relentless work and collaboration, Timor-Leste formally submitted its request for WHO's malaria-free certification. 2 WHO certification missions soon followed. In September 2024, the late Pope Francis' visit became an acid test. Over 1,000 Indonesian Catholics arrived, yet strong surveillance ensured no new cases were detected. An independent WHO mission arrived in 2025 to assess the nation's efforts. Their evaluation confirmed Timor-Leste had eliminated malaria.
Malaria elimination in Timor-Leste is more than just a triumph for public health. It's an economic victory too. By freeing our country from malaria, we are saving an estimated $1.1 million every year in malaria-related costs.
Vitória ba malagedane pertence ba Timor on Hutuniang, usi suku remotas. O oposto saúde nebe movimentado, ita hoto hamoto, protege tene família, no hatudo kata, nação que kidemos hetang Vitória bot. No banheira ita celebra on lorong, ita tem que continuar vigilante, pois está caso nebe forte, no ia vigilância ita nebe firme.
Agora sinto contente, também moras be malaria nene, agora la hija ona hija Timor-Leste.
Thank you. What you have just seen capture our country long and determined fight against malaria. A journey that united communities, health workers, and the leaders in a common purpose. On behalf of the Minister of Health, it gives me great pleasure to launch two publications that mark this achievement. The Malaria Elimination Brochure, documenting our road to certification, and the booklet of Timor-Leste major health achievements, showcasing our broader progress in public health and development. Before I conclude, allow me to express our deep appreciation to the World Health Organization, to the regional office, the country office, and the headquarters for their continued guidance and support. We also extend our heartfelt thanks to our partners and to Professor Kamini Mendes for moderating today's session. Thank you for celebrating this proud moment with the people of Timor-Leste.
Thank you, Vice Minister. That was very inspiring. You should know that people from all over the world are talking about Timor-Leste's achievements. I had a call just yesterday from a person in Latin America who asked, how did Timor-Leste do it? And now we know, briefly, as you described, how you did it. Congratulations again to Timor-Leste. And now we turn to our distinguished panelists, who are from member states and a few from partners, asking them to share their experiences and perspectives as we continue this journey towards zero malaria in the region. Let me briefly introduce our panelists. We have, of course, the Honorable Vice Minister from Timor-Leste, Mr. Magno. We have from Sri Lanka, to my right, Dr. Asela Gunawardena, Director General of Health Services in the Ministry of Health of Sri Lanka. From Bhutan, at the extreme right, is Mr. Kinga Jampal, who's the Director, Department of Health Services in the Ministry of Health of Bhutan. And we have from India, to the extreme left, Mr. Pushpendra Rajput, Joint Secretary, Ministry of Health and Family Welfare in India. And we also have panelists from Bhutan who will be joining us virtually. He is Dr. Chandra Balja, Director, Epidemiology and Disease Control Department in the Ministry of Health. We also have two very important partners. One is from the ADB, Dr. Eduardo Banzan. Is he here? Is Dr. Banzan? He's there. He's there? Oh, hello. Who's the Director of Human and Social Development, Asian Development Bank in Manila. And we have another important partner who will be joining us virtually, Dr. Bhupendra Tripathi, who's from the Bill and Melinda Gates Foundation. He's the Deputy Director, Infectious Diseases and Vaccines. I hope Dr. Tripathi and Dr. Jha are online. Let's begin the panel discussion, and I will first turn to my own country, Sri Lanka, and ask Dr. Asela Gunawardena. Dr. Gunawardena, Sri Lanka eliminated malaria in 2012, and you have managed to keep the country free of malaria for 13 long years. A remarkable achievement given that the risk of re-establishing malaria in this country is very high because you have all the vectors here and you have people coming in all the time infected with malaria. So my question to you is, what is the strength that you have that enabled you to do this? And I have a second question. Now, many people in the audience might be thinking, why should a country eliminate malaria if you still have to do a lot of work to prevent the re-establishment of malaria? And let's hear from you. Do you think it is more cost-effective to sustain a prevention of re-establishment program compared to spending on malaria control as these countries did for decades and centuries before? Over to you, Dr. Asela.
Yes. Good afternoon to all of you. Thank you, Madam. I will answer the first question. The sustaining malaria-free status for over a decade has been both an honor and a challenge for us, perhaps as demanding as achieving elimination itself. Our greatest challenge has been, as you mentioned, maintaining the vigilance at all levels at a time when malaria is no longer seen as a visible threat. Once the disease disappears, it tends to disappear from people's mind also, from policymakers, the clinicians, and community alike. In Sri Lanka, nearly all current malaria infections are imported, mainly among travelers, migrant workers, and returning peacekeepers. Preventing re-establishments depend entirely on detecting and responding to these imported cases swiftly and effectively. For this, we have built a highly responsive surveillance and response system. I am repeating, is highly responsive surveillance and response system, decentralized yet guided by strong technical team at the national level at anti-malaria campaign. Every case is investigated within 24 hours to focus a classified and tailored response, including reactive case detection. Entomological assessment is implemented immediately. This case-based vigilance is the backbone of our preventive strategy and the free state that we are maintaining. We also keep continuous flow of communication between regional malaria teams at the provinces and the hospital teams and the laboratories to maintain situational awareness. Equally important to sustain political and financial commitment also. Even after the elimination, the government has ensured that anti-malaria campaign continues as a distinct, which is under the central government, technically strong program with adequate human and financial resources. For the second question, Madam, you asked about the cost effectiveness of the preventive programs. The evidence from Sri Lanka is compelling. An analysis done soon after the elimination showed that if malaria were returned to the levels seen in 1999, the annual cost of health system could rise by as much as 13 times compared to what we currently spend on prevention. The savings coming from avoiding hospitalization, complex case management, large-scale vector control operations. But the benefits go beyond the direct costs. With malaria gone, economically productivity has improved, tourism has flourished, and Sri Lanka's reputation as a safe destination has strengthened. There are also indirect gains in education, community well-being, and overall development. Our key message to the countries approaching elimination in this: stay vigilant, sustain your technical capacity, and keep malaria on the political agenda. Elimination is an achievement, but prevention of re-establishment is the real test of endurance. Before I wind up my answer, I should mention here again our strength for the elimination as well as keeping the Sri Lanka malaria free is the dedication of our health staff.
Thank you. Thank you very much, Dr. Asir. So the message to the newcomer to the group, Timor-Leste, is that it is extremely cost-effective to keep malaria away. You spend so little, Vice Minister, compared to if malaria was there. And of course, the impact on the health of the people, that's tremendous. So with that, let me thank you very much again, Dr. Gunawardena. Let me turn to Bhutan. Dashok Kinga Jampal. The question is that Bhutan has reported 0 indigenous malaria now for 3 years. And you stand at the threshold of certification. As you enter this last mile, so to say, what have been your greatest strengths in maintaining 0 malaria, especially having a border with India, across which there are many malaria-infected people crossing over to your country?
Thank you, Madam. Excellencies, distinguished panelists, ladies and gentlemen. Firstly, it's my honor to join this panel discussion on a topic of much importance for the region and my country. Bhutan is planning to officially apply for malaria-free certification. Towards this end, a external review mission team was fielded in June this year to review the progress. Bhutan's progress towards malaria elimination is the result of a highly vigilant, community-driven and technically sound program, one that has maintained vigilance and focus even at a time when the burden of the disease is very low. Bhutan has a comprehensive surveillance and response system, one which ensures that no case goes undetected or uninvestigated. Case detection combines both passive, active, and reactive approaches, with health workers acting swiftly in line with the 137 strategy. Cases are detected within a day, investigated within 3 days, and response completed within 7 days. Information flows real time thanks to ICT and internet, mobile and WhatsApp networks, ensuring that teams at all levels, at the national, regional and sub-regional and local levels, are alerted immediately for immediate responses. Bhutan's village health workers have been indispensable in this process. Spread across all villages, these community health volunteers conduct house-to-house fever surveillance, educate families on malaria prevention, facilitate referrals for testing. They work hand in hand with the community action groups formed by health workers, teachers, villagers, community leaders, who jointly do preventive works, cleaning campaigns, monitor fever cases, monitor vector breeding sites, distribute insecticide-treated nets, conduct door-to-door residual spraying, and maintain community awareness. This level of grassroots ownership has made the malaria program truly participatory and sustainable. Another aspect is the role of the private diagnostic centers in the screening of migrant workers and foreign workers arriving from malaria endemic areas of India. This proactive screening, engaging the private sector at the point of entry, helps prevent imported malaria from seeding local transmission. The Ministry of Health also engages industries and construction employers to ensure that their workers receive timely malaria testing and prevention tools are distributed. Most importantly, recognizing the role of cross-border transmission, cross-border collaboration with India has been a defining feature of Bhutan's malaria elimination strategy. Bhutan continues to prioritize information sharing and synchronized interventions with the neighboring districts of India. Health officials from bordering districts on both sides meet regularly and carry out synchronized activities. Synchronized vector control and joint outbreak response efforts are carried out through the existing bilateral agreements and regional platforms such as SCRMF. Exposure visits and consultation meetings have built trust between the Bhutanese and the Indian counterparts and synchronized efforts on both sides. Indian laborers in Bhutan detected with fever are provided free diagnostic and treatment under the spirit of shared responsibility. Therefore, in conclusion, the success of Bhutan's progress towards malaria elimination can be summarized in 5 C's: clarity of vision, sight and direction at the leadership level and program level, comprehensive surveillance and response system, competent and committed workforce, community engagement, and cross-border collaboration. Thank you.
Thank you very much, Dasho Jamphel. Having a land border with a country that has malaria on the other side is a huge challenge, which Sri Lanka doesn't have, but which most countries have. And that, I think, is something we should commend Bhutan for, to have kept zero malaria for 3 successive years, which is the condition required for WHO to certify a country. And thank you very much, Dasho, for that intervention. Okay, so next we have a question to Nepal, and I wonder whether he is online. Okay, so this is Dr. Chandra Jha, who's the Director of Epidemiology and Disease Control in Nepal. Now, Nepal is following closely with 50 indigenous cases of malaria annually. So that's very few, and for several years now. What innovations and strategies do you think will be most important in this final stretch towards elimination? Dr. Jha.
Thank you. Thank you, Professor Mendes, and warm greetings from Nepal. Nepal has made strong and steady progress in malaria elimination by 2024. We reduced indigenous malaria cases over 95% compared to 2014. This success reflects consistent commitment and a strong collaboration across our health system as well as partners. Now we are focusing on sub-national elimination and have formed Malaria Elimination Steering Committee at national, provincial, and local levels to improve coordinations. In the last year, 2024, Nepal reported 1,043 malarial cases, and 96% were imported, mostly among Nepali migrant workers returning from malaria endemic states of neighboring countries. Today, our greatest challenge is imported malaria. These cases often occur far from the border, making collaborative surveillance and response more difficult. To address this, we rely on sensitive case-based surveillance, where every case is investigated and followed by immediate response within 24 hours. Our female community health volunteers and village malarial workers play a vital role in identifying returning migrants and ensuring they are tested and treated promptly. However, preventing importation requires joint action beyond borders. We believe cross-border collaboration with India, especially at the state and district level, is essential. Timely information sharing and synchronized intervention can greatly reduce the risk of onward transmission. As we move toward elimination, we are committed to keeping malaria high on the national agenda, achieving malaria elimination through stronger partnership, community engagement, ensuring robust surveillance, quality assurance, and continuous financing so that disease will not re-establish. Nepal's last mile will depend on addressing imported malaria and sustaining regional cooperation, because malaria anywhere remains a threat to everyone. Together, we can make malaria history in Nepal. Thank you.
Thank you very much, Dr. Jha. So we've heard from every panelist so far that surveillance and response in real time is really the key to eliminating malaria and keeping the country free of malaria. Thank you again. We now turn to India and Mr. Rajput. India has significantly reduced its huge burden of malaria over the years. And you are now turning to resorting to a subnational elimination, that is states and districts, and verifying that elimination. Has that process gone well? Has it inspired other districts to eliminate malaria in India? And has it also been supportive of your neighboring countries' efforts like Bhutan, Nepal, and Bangladesh?
Thank you very much for this opportunity. Honorable Chair, distinguished delegates and esteemed colleagues, good afternoon. India has set a clear and time-bound goal of eliminating malaria by 2030 with the intermediate target of interrupting local transmission and achieving zero indigenous cases nationwide by 2027. Given the vastness and diversity, India adopted a sub-national elimination and verification strategy approach that recognizes malaria heterogeneity and allows for targeted district-specific interventions. India's approach to sub-national malaria elimination and verification is a testament to how a diverse and vast nation can turn its complexity into a powerful advantage. Malaria elimination is a challenge that demands commitment, persistent efforts, and innovation. Recognizing this, we have embraced a strategy that stratifies districts based on annual parasite incidents, allowing us to tailor our interventions, surveillance, and resource allocation to the unique risk and capacity of each area. This district-level focus is the core of our success. By categorizing districts into 4 groups, we implement targeted measures that address local realities. This means our vector control, case management, and surveillance activities are not just broad strokes, but carefully calibrated actions designed to create maximum impact. Our efforts have yielded significant results. From 2015 to 2024, India recorded a 78.1% decline in malaria cases and 77.6% reduction in deaths. These numbers tell a story of progress, but they also remind us that the fight is far from over. Our strategy now also includes verification at the sub-national level, so that districts which achieve zero indigenous cases for 3 consecutive years submit dossiers for independent verification by the Sub-National Malaria Elimination Advisory Committee and an evaluation committee. This rigorous process strengthens efforts at the level of local health systems and ensures that gains are sustained through robust prevention of re-establishment or POR measures. Excellencies, decentralized planning is another pillar of our approach. District-led micro-planning enables faster, more responsive decision-making. Strong accountability and ownership of the program at center and state level ensures that the program implementation is focused and effective. This strategy also ensures that district health teams, those closest to the problem, are empowered to lead the efforts, fostering a sense of ownership and accountability that is crucial for lasting success. India's strategy also recognizes the importance of collaboration beyond borders. A special focus on border districts drives bilateral and subnational coordination with neighboring countries like Bhutan and Nepal. Together, we share surveillance data, synchronize vector control efforts, and reduce the risk of malaria importation. The evidence of our acceleration towards elimination is clear. The number of districts classified as category O, those free of indigenous malaria, has nearly doubled in just last 2 years, reaching 235 districts in 2025. More than 20% of all the districts now qualify for sub-national malaria elimination and verification, showing a healthy competition and a commitment to accelerate action across the country. Meanwhile, only 37 districts remain high burden, highlighting where our focus must sharpen in the coming years. Excellencies, we look to WHO Zero to continue its vital role in harmonizing verification standards, sharing lessons learned, and strengthening regional learning. By harnessing our diversity and focusing on local realities, India is not only on track to eliminate malaria by 2030, but is also contributing towards a malaria-free Southeast Asia. Thank you very much.
Thank you, Mr. Rajput. Because India is so critical to the region, as far as malaria is concerned, we are encouraged by the progress you're making, and we look forward very much to India reducing greatly your malaria burden. With a large country like India, there is no other way that this can be done except by going district by district, or state or province by province. And other countries have done this very successfully, like Indonesia and the Philippines. They have made great progress by eliminating malaria province by province. So we wish you luck in India. We now turn to our partners, and we have two very key partners on the panel today. And I'd like to ask Dr. Eduardo Banzan from the ADB. I hope you're still here, Dr. Banzan. From the ADB's perspective, what are the most strategic areas where development financing can support malaria elimination and sustain the gains achieved so far? I ask this because many will agree with me that the countries that have eliminated malaria in the past 2 or 3 decades have all been attributed largely to funding from the Global Fund, which is to a great extent correct. But we know that ADB has supported countries for many, many decades on development assistance, and countries have used these funds for malaria control and elimination. Can you speak to this and tell us where, I don't know where he is, okay, and tell us where you think development assistance can push the elimination agenda much more?
Thank you very much. So there are 2 particular areas that we in ADB are supporting. But first of all, let me congratulate the countries Timor-Leste and of course Bhutan and Sri Lanka for eliminating malaria. And for us, at the end of the day, this is a story of strong health systems. Okay, although we appreciate vertical programs, sustaining this is strong health systems. So ADB has been supporting countries, and our actually first engagement with Bhutan and Sri Lanka in recent years was driven to support strengthening health systems of Bhutan and Sri Lanka with ADB projects with an element on addressing malaria. So we will continue to work with our developing member countries to strengthen their health systems. Now, we also recognize that malaria, in order to be continued to be controlled or eliminated, there's an element there which is, of course, much discussed, which was that malaria, I think I love it when health minister says it, and a number of, is that malarias do not need passports to travel between countries. They do not require visas. You could not stop them with your usual immigration circle. So there is a lot of movement. And unfortunately, sometimes a lot of these interventions between countries have difficulty investing in them. countries, it's much more easy for countries to invest for something that will benefit the country directly. But in a sense, regional interventions, or what sometimes we call externalities, needs to have other sources of funding, much more global, much more shared. And within ADB, we recognize this. We call this regional public goods. We do have instruments in ADB which will provide financing for regional cooperation and integration. When we did our first engagement with Sri Lanka and Bhutan before the pandemic, we've actually used some of these regional funds, which we call our ADF-RCI, and we provided it as part of the loan, of the grant to Bhutan and to Sri Lanka. And so we will continue to mobilize, and we're exploring to mobilize this regional cooperation money in order to address, in a sense, this element of malaria control, which is the movement between countries. So these are the two elements that we would like to focus on: strengthening health systems and supporting regional interventions.
Thank you very much, Dr. Benson. Some people believe, and it's reasonable, I think, to believe that the reverse is also true, that as a country develops and people's lifestyles improve, that it's so much easier to eliminate malaria. And ADB's development assistance for a long time, for years and years, must have led, even in Sri Lanka, to better road systems, better access to healthcare, and improving people's housing and so on, all of which I think there is no doubt that all of that has contributed to the elimination of malaria. Thank you. And now we have the last panelist, but not least, Dr. Bhupendra Tripathi from the Bill and Melinda Gates Foundation. I think he's online. Dr. Tripathi, welcome to the session. And the question to you is, from the Gates Foundation perspective, what are the opportunities for innovation and partnership that could help countries eliminate malaria?
Good afternoon, everyone. Thank you, Madam. Thank you, Chair. Let me start by thanking WHO Acting RD, Dr. Catherine Rizal, for inviting me for this meeting. And I also want to thank and congratulate all the country program dignitaries for the wonderful progress they have made in malaria elimination. So nice to see that Timor-Leste is joining the August group with Bhutan and Sri Lanka. And I'm sure more countries are lined up for the progress. So I think the question what has been posed to me is regarding innovations and other things in coordination. I think the first and the foremost thing is that we need to always remember that malaria is perhaps one of the diseases which has shown rebound or coming back in a big way. And if we strengthen the surveillance, we will actually come to know what is the current status. I can speak about India, and our Joint Secretary, Mr. Rajput, has very well spoken about the strong surveillance system what he has initiated. We are finding areas where the number of cases are actually going up. So we have to figure out what are the reasons for that. And when we classify the types of malaria, like, falciparum in one geography versus virus in another geography, I think these things are very important. So the first and the foremost thing is that we need to improve the current implementation on what we have and strengthen the system, not only for surveillance, but also for figuring out, okay, how the treatments, how the capacity building can be done. And the most important thing is to follow up the patients, because there are patients who may come back with a relapse. In terms of engagement with other institutions and coordinations, I think the research bodies are very important today, because all of us understand that there have been cases of resistance, whether it is drug resistance, whether it is insecticide resistance, or other types of reasons. So we have to have concurrent system of having studies, both for humans as well as for vectors, to identify these resistance. So we have been working with the multiple countries across the globe, including India, for having new drugs brought in. For example, tefenoquine. So the whole phase 3 trial which is going on in India will help not only India but neighboring countries as well. For that G6PD diagnostic kit, we are in the final phases of getting a affordable G6PD diagnostic kit for the countries. In addition to that, there will be always a role of gene sequencing. I think we have to go to that level to identify, okay, which specific insecticide a specific vector is resistant to. And then we have to also work very closely with the private sector in addition to the research organizations. Because the private sector will be the body which will bring up the new things at scale. So getting the new drugs, new diagnostics, new insecticides at an affordable price will be a very important topic for all of us. Moving forward, we have to leverage multiple vector-borne disease control programs. As discussed yesterday in the session what Dr. Aya had led, I think Dr. Rishanta and Dr. Aya have shown a very good model wherein the vector-borne diseases, which are neglected tropical diseases, and malaria, how we can integrate ourselves, whether it's for surveillance, we can use some sort of sero surveys, we can have joint active case searches, we can also figure out how can we do integrated vector surveillance and control. Similarly, genome monitoring source will be very important because when we find a vector, why not find out for malaria as well as for lymphatic filariasis, for dengue, chikungunya, etc. So that type of integration will require new diagnostic kits, some types of multiplexes which we can think about in the program. The next thing which I would like to emphasize is the private sector. As all of us know that all these countries in this region do have a flourishing private sector. So my humble submission will be the data systems have to be made in such a way where the private sector is able to put in their data timely. And that data is available to all the program managers for swift action. The next thing which I would encourage is about joint reviews and monitoring system. For example, if the team is going for one type of vector-borne disease control program review, why can't we integrate with a couple of other programs? That will help in reducing and optimizing the resources and will also help in strengthening the systems. The role of entomologist is very important. And I have seen few countries who have done wonderful job with entomology. I would like to appreciate Sri Lanka for doing that great work, where the entomologists are leading the program for vector-borne diseases. We also have good principles and examples from other countries like Nepal and Bhutan. I think in India also, there are a couple of states which have done great job. But as a whole, I think this is a sector for which we need WHO guidance and advocacy because this is going to be required forever. It's not like for reaching elimination. We all understand we are eliminating for these diseases as a public health problem. We are not making zero cases for now. We will be reaching that milestone. But even that, we will be requiring post-elimination surveillance and role of entomology will be very important. So my submission is that we should think about that. And finally, I would like to say that the role of LLINs, the insecticide nets which we are having, we all understand Global Fund is providing resources to a couple of countries. But those countries who have gone below API 1, these geographies will still require these type of kits for some specific hotspots. How can the countries identify those areas? How can they channel their resources towards that? That will be very important. Finally, I would like to say that Gates Foundation will be available not only for system strengthening piece, but it will be also available for working with WHO headquarters, regional office, and country offices to strengthen innovation in these countries. With this, I want to thank all of you for the picture. Thank you so much.
Thank you, Dr. Tripathi. I think we all agree that we need new tools, but I think Timor-Leste has shown us that we can eliminate malaria with existing tools as well. Thank you. I'd like to wrap up now in view of the time constraints we have. I'd like to thank all the delegates for their and the panelists for their valuable insights. Just want to leave you with a message that the WHO's simile to a marathon is a very good one, but a marathon ends at the finish line, but malaria elimination does not. It's not the end game. The end game is keeping the country malaria-free. So WHO also has just published guidance for the first time on how countries can prevent the re-establishment of malaria. So that's a very important development. It's now my pleasure to invite Dr. Suman Rijal, who's the Director, Department of Communicable Diseases, WHO CRO, to deliver the closing remarks.
Thank you very much, Chair. Your Excellencies, distinguished delegates, Officer in Charge CRO, colleagues and friends, as we come close to this inspiring session, I wish to extend my heartfelt thanks to all our panelists and partners for their valuable insights, and to Professor Kamini Mendes for her excellent moderation. As Professor Mendes so aptly said, a marathon may end with the finish line, but malaria elimination does not. Preventing re-establishment is our shared responsibility, one that continues until the world is entirely free of malaria. On behalf of WHO, I once again congratulate Timor-Leste on its remarkable achievement and thank all member states and partners for their steadfast commitment and collaboration. Thank you so much. We now close the meeting. Thank you.